Hello everyone, and welcome to this week's video on wheelchair fitting. So we'll start with our different types of wheelchair measurement. So you use just a little tape measure. Usually it's like a fabric or like a clothing tape measure because it's flexible instead of like a regular tape measure used to measure like wood and stuff. So PTs, physical therapists, perform wheelchair evaluations usually, but PTAs, we can assist with the measurements and recommendations since we may work with the patient more often than, say, the PT would. So you want to make sure your patient sits with straight on a firm, flat surface, and then you want their hips, knees, and ankles positioned in 90 degrees of flexion, if possible. And you want to perform these measurements carefully because any minor, not inconvenience, but any minor problem that may come with fitting it wrong is detrimental to the patient and could hurt their overall health. And so next we'll start with the specific measurements. We'll start with seat height and or otherwise known as leg length. So for this one, you will measure with your measuring tape. You'll measure with from the heel of your foot to the popliteal fold, which is the back of your knee. And you can then subtract the height of their seat cushion if they have one. And then you want to add 2 inches for foot plate clearance from the ground. But if they're in a hemi chair, you don't want to add those 2 inches because you don't need to, because there won't be a foot plate. So next we're going to do our seat width, which is where you measure at the widest part of the patient's, either their buttocks, their hips, or their thighs, whichever is the widest. And then you want to add 1.5 inches. And then next we'll do our seat depth, which is you measure from their posterior buttock to the popliteal fold, and then you want to subtract 2 inches. And then next will be our back height. You want to measure from the seat or chair surface that the patient is sitting on, and then you want to measure to their axilla with their arm in 90 degrees of flexion. And then you want to subtract 4 inches. And then next we'll do armrest height. This is where you measure from the seat of the chair or the surface that they're sitting on to their olecranon process when the elbow is flexed to 90 degrees. And then you add 1 inch from that measurement. And then you can also add the height of their seat cushion if it's applicable. And then to confirm the fit of all these, you want to first, of course, make sure that the patient is sitting in the center of their wheelchair and scooted all the way back, where their back or their butt is touching the back of the backrest. And so first is for seat height. You want to have 2 to 3 fingers underneath their thigh at the front edge of the seat. And then you want to make sure the foot plates are 2 inches from the floor. For seat depth, you want 2 to 3 fingers between the popliteal fold and the front of the seat. And then for seat width, you want just 1 hand between the width of the buttocks and the clothing guard or the armrest from both sides at the same time. And then for back height, you want 4 fingers between the top of the backrest and the axilla, and the inferior angles of the scapula should be 1 finger above the backrest. For armrest height, you want to have the patient's arm on the armrest, and you should notice that the patient's shoulders should be level and they should have an upright trunk. So all of this is to make sure that they don't get any pressure ulcers or any of that bad stuff that'll alter their health. So if you have any questions, please drop a comment. See y'all next time.